Hello everyone, I'm Mark Crowman. I'm the Place Executive for Wandsworth at the Integrated Care Board, the ICB. So NHS South West London brings together all health partners and all health and social care partners in Wandsworth to basically improve the health outcomes for the people of Wandsworth. And we also have responsibility for the budget. So actually, how do we spend our NHS money on the residents of Wandsworth and the services? Both Healthwatch and Wandsworth Care Alliance are absolutely key partners to the delivery and the development of those services. And they sit on our local borough committee and advise us basically around what the communities need and the great work that the voluntary and community organisations do, but also what are the views of our patients, which is really, really critical to our success. Some of the key projects that we've worked on are such things like the community grants funding, which really enables us to fund grassroots organisations in becoming businesses, but also in developing services for our residents. And we've also learned that research, particularly the Healthwatch research, enables us to shape and influence the delivery of services so that we really are targeting and listening to our patients. We look forward to continuing the brilliant work that Healthwatch and Wandsworth Care Alliance do and continuing to build on that partnership. Thanks very much.
Hi folks, my name's Lucy Brooke and I'm director and co-founder of Free2Be, and I've just come along today to tell you about our work in collaboration with the wonderful Wandsworth Care Alliance. So we've been supported by Wandsworth Care Alliance for as long as I think Free2Be has existed, since 2015, and they've helped us in so many different ways, from being able to advertise volunteer opportunities, sharing our information, promoting our training through the fabulous newsletters that go out, chairing the voluntary sector meetings, which are always fabulous. They've supported the LGBT network in a number of different ways. So we chair a network of all of the different LGBT services in the borough, and the Wandsworth Care Alliance has fantastically been able to help us promote that network via their website, because we didn't have a space for that to sit for communities to be able to find that information. So they're currently hosting a little web page for us, which is fantastic. Another recent thing, support we've had through the Care Alliance is a Healthy Champions grant that they've administered, which is fantastic. We received that grant and we're running a healthy eating project in our youth club, which has been great. So a massive thank you to all at Wandsworth Care Alliance. I hope you have an amazing AGM. Have fun.
My name is John Gillespie. I'm a voluntary sector consultant, and I recently worked with Wandsworth Care Alliance on a project that was commissioned by Wandsworth Council to review Black, Asian and minority ethnic people's experiences of day opportunity services. WCA's commitment to bringing together and supporting partnerships of voluntary organisations in delivering health and social care outcomes made you an excellent partner. I'm particularly grateful to Dominic for all the help you gave us throughout the project, particularly the support in reaching smaller community-based organisations. And I want to acknowledge the important work that WCA does alongside other partners such as Wandsworth Community Empowerment Network in supporting racial equity and better awareness of systemic racism and exclusion. I hope you'll continue to do that work.
Hi, I'm Megan. I'm the Head of Operations at Power to Connect. Power to Connect is a digital inclusion charity based in Wandsworth, and we recycle and refurbish unused devices such as laptops, tablets and smartphones and redistribute them back out into the community in line with Wandsworth Council's deprivation data. We also provide free digital skills sessions and digital drop-in support across the borough. And we recently worked with Melanie from Wandsworth Care Alliance, who helped us with the process of converting from a community interest company into a charity, which can be quite a long and complicated process, but Melanie was super helpful, and I'm pleased to say we got our charity status in early August, which is great. We are also highly reliant volunteers, so we are part of the volunteer brokerage service that helps connect us to people in the community that are looking for volunteer opportunities.
Hello, I'm Joanne Taylor Villanueva. I'm a senior public health lead at Wandsworth Council. I lead on prevention initiatives as well as health improvement area, which includes adult weight management. Recently this year, we've been working with you on developing specifications for that service. It was really important to work together on co-production and understanding the needs of the community, whether it was what types of languages we should be offering this service or making it more accessible at community locations. And another key project we worked on this year was the Healthy Place, Healthy Weight project. And that was really exciting to really go to the table, hearing real stories from real people, because this really solidified what we need to do next to make sure we can work together and encourage people to have a healthier weight to prevent poor health outcomes.
Thank you, Joanne. My name is Dr. Nike Arobusoy. I'm a consultant in public health in Wandsworth Council, and I've been working since 2019 with the Wandsworth Care Alliance, in particularly on the Health Watch project. And the key highlights from the work for me have been the work we've done together on health inequalities and community action, which is quite exciting because when you think about it, we work together on accessing and assessing healthcare needs, understanding what people say they need, and looking at the data, looking at the evidence, as well as having conversations about, well, what have we learned that people really need? What have we learned about people's health conditions? And that ensured that the Joint Strategic Needs Assessment, now that's a report that actually affects the strategy that the Council and Healthcare will deliver to improve health. And having the voice of the community in there was very important, and we were able to do that with the help of Health Watch. I also welcome the summit and the support we have had from Health Watch to address health inequalities. We've had focus for 2 years running on diabetes prevention, which brought people who had diabetes, the voluntary sector together, as well as the providers, to really discuss together what plans could look like.
My name's Sandy, and I'm Head of Integrated Care and Transformation for Merton and Wandsworth ICB. And I've worked with Sarah for probably about 5 years now, and as in her role as lead for Health Watch. And it's been a really productive and helpful relationship because when we're doing big transformation schemes, I get the support from her. And I think it's a particularly important time was obviously during COVID. And we were having to get people out of hospital really, really quickly. And Sarah and I sort of touched base a few times to say, how are things? And she was giving me lots of information about experiences of very poor discharges from hospital. And I said, right, yes, I can imagine that is happening because the speed with which we had to get people out to make sure we had more beds for more people. And so from that, we then really looked at what we could do to really get more quality and get some feedback into the system and into the partners to really understand what we could do differently. And Sarah said to me, what I'd like to do is be able to interview a few people and really get a full piece of research out. And so I have to say, given how busy everyone was, they were very obliging and said, yes, we want to do this too. We want to see what's happening and what the impact has been on families and patients and people. So we identified quite a number of people. And then obviously Sarah then had that ability to go and talk to them specifically. And what was great was from that piece of research, a lot of sort of developments come from it. One was really getting together in the hospital to look at how we could our communication could be much better. There's still a lot of work to do there, but we are looking at much more shared, coordinated discharge hub going forward. And the other really important element has been how important the role of the unpaid carer is in the hospital discharge. And I think it's only recently have hospital really recognised that this is just crazy, that they're doing all this discharge summary for the patient, but not actually taking into account what the unpaid carer's needs are in being able to take that person back. And so as a result of that, we're now one of the forerunners in the country for implementing a carer's discharge toolkit. So that all came about from that conversation that I had with Sarah during COVID about how we really need to raise the profile of what's going on for people who are being discharged. And it's gone all the way up to NHSE as well. So we now have very much a spotlight on us in Wandsworth and Merton about what we're doing around carers, and obviously with this discharge toolkit.
My name is Haran Tillanathan. My main interaction with WCA is as a volunteer with Healthwatch Wandsworth. So in my role on the committee, I sort of input into sort of governance and strategy for Healthwatch Wandsworth. And in my sort of volunteer role as a representative, I have worked on sort of areas including pharmacy provision in the borough, and I'm now getting quite a bit more involved on sort of social care matters. And then, as I am myself visually impaired, I've also helped Healthwatch Wandsworth do quite a bit of engagement with the blind and partially sighted in the borough over the last year, with a couple of events. What I found most interesting is engaging with communities within Wandsworth and sort of understanding a bit more about sort of what their sort of needs are and what, particularly in terms of health and social care, and also understanding the various service providers and service provision and issues relating to health and well-being in Wandsworth, which is quite for me in my day job. I sort of work on quite a lot of national related issues and policy, so being able to come down and distill that into sort of at a local level and connect with the area that I live in has been really rewarding.